Jean Ho. Morning, Dr. Jean. Hello.
Hello, hi everyone.
Hi.
Good morning.
Yeah. So we're very happy to have you with us today. We're going to start very, very soon, okay? We promise. Likely, if you're here, we understand that maybe you yourself, you have some concerns about atopic dermatitis, or maybe you're looking to ask for someone else that you know, could be a child, could be a baby even, a relative, a friend. So we're very interested in having you here with us, speaking to Dr. Jean as well about this issue of atopic dermatitis. Just to let you know, Dr. Jean Ho, she's actually a specialist in dermatology with over 20 years of experience. So Dr. Jean, I imagine that you are the perfect person to speak to about this if someone is concerned, yeah? And I want to say a big thank you before this event starts proper to Uriage. So if you've never heard of Uriage, you've probably seen their products around in supermarkets, in your Guardian and Watsons. Since 1992, Uriage Dermatological Laboratories actually has been creating dermatologically tested hypoallergenic skincare products using Uriage thermal water. So it's very special water to protect all different types of skins of all the family members every single day. Now, it's about 11 a.m. right now. So I believe that we have a video for you to learn more about Uriage before we begin. Is the video ready? All right, so we're gonna show that to you in a few seconds. Hope you enjoy it.
It is in the heart of the French Alps that the Uriage thermal water has flowed for 75 years. Through many layers of rock, rich in calcium sulfates and sulfur schists. It is enriched with minerals and trace elements released by this unique geological structure. At the very heart of the Uriage-les-Bains village, it spouts to create a source of thermal water with a constant composition, isotonic and bacteriologically pure. Its unique mineral composition provides a triple action on the skin. It hydrates by reinforcing the physical barrier. It soothes by modulating the immune barrier. And it protects by rebalancing the microbiome barrier. It also has a healing, anti-free radicals, and filmogenic action on the skin. Since 1823, the Uriage Thermal Center makes available all the extraordinary benefits of its water. The Uriage thermal water was acknowledged as a public utility by the National Academy of Medicine in 1877. Today, the center welcomes 4,500 patients every year, possible from 6 months old. It was recently refurbished to offer more comfort and modernity to its guests. It is also one of the few thermal centers offering treatments in 3 groups of disease: dermatology, ENT, rheumatology, where patients can then benefit from 2 treatment orientations at the same time. Particularly important for post-cancer patients. These treatments use only active Uriage thermal water, whose efficacy is demonstrated by numerous clinical studies. 77.5% of the patients feel that their condition was cured or improved. 76% of the patients reported a decrease in medication consumption. 83% of the patients leave the center without clinical signs, or with light to moderate signs. Uriage goes further in the management of chronic diseases by offering a comprehensive approach. Support group, sophrology, reflexology, yoga. Uriage has encapsulated the benefits of the Uriage thermal water in its products. Pure and protective skincare with the latest developments in biotechnology, all thanks to an innovative research and development team combining exclusive patent and natural active ingredients. Uriage protects the skin of the whole family every day in over 80 countries worldwide.
Yes, so once again, big thank you to Uriage for putting this very informative session together. I'm sure it's going to help a lot of people today. So actually, to thank you, every single person that's joining us on this Zoom meeting call, to thank you for waking up on a Saturday morning and joining us. want to let you know that you will receive a goodie bag at the end of this session with 6 different Uriage products inside. So I had a look at the bag. I want to let you know that most of the products, in fact, all of them are very, very good for dry skin especially. Had a look inside, there's something there where if you are constantly itching, obviously it gets worse if you're scratching all the time, right? Get wounds and stuff like that. So there are products there that soothe the itching so you don't make it worse. If your skin is already cracked from long periods of dryness, there's also stuff in there from Uriage to repair old as well as newer cracks. So very, very helpful. I'm going to let you know how you can collect your goodie bags at the end of the session. So if you can, please stick around. But more importantly, because we have something very, very informative coming up for you. So Dr. Jean Ho, thank you so much. You've been waiting here patiently for 5 minutes. Very excited to introduce you. Good morning.
Good morning. Good morning, Kim. Good morning, everyone.
Now, I want to let you know a little bit more about Dr. Jean Ho. So again, as I mentioned earlier, she's a specialist in dermatology, over 20 years of experience and medical experience, so very, very qualified to speak with us today. Her areas of interest include laser and cosmetic surgery, as well as pediatric dermatology. So if you've got a baby with some skin problems, please ask Dr. Jean Ho some questions as well. She also has many areas of expertise, including rosacea, eczema, pimples, and pigmentation. Lots of people struggle with that. And she specializes in treating skin diseases, not just in adults, but in babies and children as well. It's a very important time in their life where their skin can affect their self-image. So now, Dr. Jean Ho, if you go to a clinic, if you speak with her, she will provide a range of non-invasive, non-surgical procedures that will restore your skin's health and natural beauty. I want to say that earlier on, and before this event even started, we asked you to send in some questions for Dr. Jean. So thank you so much for doing that. Promise you we're going to do our best to answer as many of them as we can in just a few minutes. But Dr. Jean, I'm very interested. Would you share more with us about atopic dermatitis?
Well, yes, certainly. That would be my pleasure.
All right.
Okay.
Now, I believe you have something prepared, a presentation. Is that right?
Yes, I do.
Ah, okay.
Okay. Okay. All right. So without further ado, okay, let's get started. So hello, everyone. I am Dr. Jean Ho, and Kim has done a really kind introduction for me. Thank you so much, Kim. So I have a private practice at Mount Elizabeth Medical Center. I'm also a visiting consultant to the Pediatric Dermatology Service at the National University Hospital. So in my practice, I see both children and adults with atopic dermatitis, and I have helped many recover from it. So today, it is my pleasure, great pleasure to share some of my experience with you. So atopic dermatitis, it's also known as eczema for short. It's actually a very common skin problem and can affect roughly about 30% of our children. And this is actually a significant increase from 20%, which was about 15 or 20 years ago. So the trend is going up. And although the disease predominantly starts in childhood, but adults are known to get it as well, right? So, and family history is a very, very important risk factor for developing atopic dermatitis. Now, to sort of like, ease all of us into the serious stuff, okay, I'd like to kind of, share with you the story of baby James. So this is baby James. James was a healthy, bubbly baby. But at 3 months of age, he suddenly developed these red, angry-looking rashes on his face and body. He became cranky, was restless. He would scratch at every opportunity he could get. With some treatment from the pediatrician who saw him, yeah, his skin got a little bit better, but it would, flare up again whenever the treatment was stopped. Now, by the time James was 3 years old, Mom and Dad would have to keep the air conditioning in the room on throughout the whole day and night, just to keep him cool, and to stop him from itching. He couldn't spend too much time out in the sun playing because the sweat would just simply irritate him. And oftentimes he would scratch himself so hard until the skin would break and bleed. And for little James' bath times, they were no longer fun because, the water would just cause his broken skin to sting so badly. And when James got to school, right, and he joined the school band, he started playing the violin. But, that was when skin started to turn for the worse because, his hands would start to crack up and they would give him such painful blisters and cuts, it would be impossible to practice. And of course, since 2 years ago, the start of COVID-19 pandemic, the endless hand washing and sanitizing, that didn't help either. As he got older, James became more self-conscious about the way his skin looked. He would shy away, from social interaction with his friends. And he was particularly annoyed at the thick, sort of like leathery looking scars on his neck and his face. Now, atopic dermatitis caused James intense and continuous itching and scratching. It was impossible to stop. But every time he scratched, he would damage his skin further. And that would aggravate the dryness and the inflammation. And the cycle would repeat day after day. So how was he to recover? If he had to recover, we had to stop that itch and stop it quickly. So, ladies and gentlemen, James was in fact a fictional character, okay? So by no means, resembling any living person. However, his life story and experience is extremely real. Believe me, it is lived and relived, okay, by countless of children or adults with atopic dermatitis. Now, so why is atopic dermatitis becoming so common these days? Well, firstly, it seems like the rapid urbanization of our cities is having, an impact on the trend. Perhaps it's growing up in a smaller family unit, or maybe exposure to antibiotics from, an early age. Could be the overuse of disinfectants, cleaning agents, and detergents in the house. Westernized diets, these are all believed to contribute to the problem. And interestingly, babies who are delivered through cesarean sections have a higher risk of developing atopic dermatitis compared to those who were born through a normal vaginal delivery. So what is atopic dermatitis? And why did it happen? Why? Why me? Why my child? Well, before we understand that, let's look at the skin. So for many of us, we tend to take our skin for granted. We do all sorts of things to it. Yeah, we scrub it, we pluck it, we wax it. Yeah, and every time we do these things to the skin is working doubly hard, to restore itself and to help to preserve and protect us from the harsh environment outside. The skin is tough and strong, enough to resist breakage and physical stress, but yet it is flexible enough to stretch and bend to an immense degree. The skin is also a vital membrane. It keeps the good stuff in and keeps out the bad stuff. It also has a very important and natural immunity, protects us from infections and external insults. So then what is atopic dermatitis? Well, simply put, atopic dermatitis is a breaking down of the skin's barrier and immune function. So when this happens, insults such as allergens, microorganisms, these can get into the skin. It causes inflammation. And inflammation makes the skin red, itchy, and dry, which leads to the loss of precious moisture from the skin into the atmosphere. And this leads to further dryness and cracked skin. So, we can see a cycle forming over here. So What can trigger atopic dermatitis? Well, basically anything that weakens or threatens the skin barrier can trigger a flare in atopic dermatitis. It could be dryness from long hours spent in an air-conditioned room, or perhaps too much heat and sweat, irritants such as detergents, soaps, environmental allergens like dust mites, smoke pollution, infection, and of course, not to mention immune stimulation, like the trending topic, COVID-19 vaccination, among other vaccinations. So there is also this sort of great discussion about food and atopic dermatitis. Is there a link? Can food possibly cause or trigger atopic dermatitis? Yes, no, not sure, maybe. Well, honestly, nearly every patient that I see in my practice will tell me that certain foods, could be the prawns or the crabs, or maybe it's milk, or maybe it's peanuts, or maybe it was chocolate, that was somehow partly or wholly responsible for their eczema. And they would take great pains to avoid eating them, just so that they, in the hope that the eczema could go away. Well, the picture is not so simple as that. Okay, this is because although studies have found that a significant, yes, quite a number of children, 1/3 of the kids that is very young, less than 5 years of age, can have food allergy together with their atopic dermatitis. But when we looked at older kids and adults, it was found that food allergy was actually very rare. So, before you rush and, try to eliminate different food or food groups from your diet or your kids' diet, speak to a dermatologist first or an immune specialist. Because if you or your child did not actually have a food allergy, blaming the food or foods for your skin condition, it's going to look like, barking up the wrong tree. And we're now in the midst of a pandemic. Hand washing, mask wearing, these have caused hand and facial dermatitis to spike. And these can occur even in people who do not have a prior history of atopic dermatitis. So I would like to remind everyone, try to use a gentle cleanser as much as possible. Use less antiseptic soaps, which can be simply too harsh for your skin. Moisturize, moisturize, and moisturize, especially after washing your hands. Now, when atopic dermatitis moves into the chronic stage, it can cause changes, permanent changes on the skin, such as, thick, hardened lumps, as we see on the picture, which can be excruciatingly itchy. Or the disease could spread very slowly over time to involve a large surface area and sometimes even the whole body. What about the psychological impact of atopic dermatitis? This has been well recognized. And I see that every day in my patients, young and old. The loss of sleep from constant scratching, that's a big problem. A young child with atopic dermatitis tends to be more hyperactive, irritable, unable to focus in school, poor attention span. In adolescent, self-image becomes an issue. Perhaps it's a fear of being judged by others. Then there are feelings of shame, exhaustion, isolation. And the stress of atopic dermatitis doesn't stay with the patient. It affects the family as well. If the poor child is unable to sleep, neither will the parents. Everyone will be kept up awake at night. And as the disease drags on, we begin to see feelings of hopelessness, burnout, and even apathy just completely taking over. Now, all these emotions, they contribute to this vicious cycle. It increases stress, which in turn causes a worsening of the disease. So this is a wonderful study, okay, that has followed children over the years and see, what sort of progress do they grow out of it, or does the disease stay with them? And well, thankfully, 2/3 of the children seem to outgrow the disease. That's good. That's some good news. However, what about the rest who do not? Some of them will continue to have eczema as adults. And some of them may even continue to develop other diseases like asthma and allergic rhinitis. And this we call the atopic march. Now, what if we can avert this outcome for this group of patients? What if we can reverse the process? What if it's not too late? What if we can help some of these kids outgrow the disease and join the lucky ones? Can we, so to speak, change the course of history for some of our patients? In short, the answer is yes. With more effective and safe treatments which are available now, it is possible for patients to be fully in control of the disease. It is possible that fewer patients will need to suffer the burden of chronic disease. A recent breakthrough in treatment is biologic therapy. So this has already been approved for use in children from as young as 12 years of age all the way to until adulthood. And patients who have received this treatment have reported tremendous improvement in their eczema, in their skin, and also the quality of life. So an effective treatment of atopic dermatitis allows patients to resume most of their physical activities with no disruption to their life. So if you or your child has atopic dermatitis that is not getting better, it keeps coming back, it is impacting your sleep and life, seek help. Get in touch with a dermatologist. Always seek professional advice. Do not self-medicate. Do not just simply rely on information from the internet. Always fact-check whatever you read. A dermatologist is specialized in treating both simple as well as complex skin conditions. And a dermatologist is well-positioned and the best person you should go to provide you with the medical advice and the necessary care for your skin. And if you do have young children with atopic dermatitis, think about consulting a pediatric dermatologist who is experienced in treating children with skin diseases. To sum up, it is possible to recover from atopic dermatitis. Remember, recovery is a journey. It requires that you absolutely, deliberately, and consistently stick to the plan. Always in partnership with your dermatologist. Keep to your medical appointments. Do not default just because you think that you are better. And before I end, I'd like to finish off with some useful tips, that you can keep in mind in managing your atopic dermatitis. always use a gentle cleanser as much as you can. These cleansers do not dry out your skin. They help to preserve the natural, healthy skin pH, which is so vital for maintaining a healthy skin barrier. Moisturize as often as you can and try to keep cool. Wear loose, soft clothing if possible. And when you're in the midst of a flare, you might need to just stay away from physical activities and sweating. However, once the skin is already on the road to recovery, you can ease yourself into your exercise and the activities that you enjoy. And so important to seek treatment early and not to allow the skin condition to worsen on its own. Now, this is also another question that I get asked all the time. So, Dr. Ho, are the steroid creams safe? Can I use them for the long term? Is it going to harm my skin? Is it going to thin my skin? And I want to assure all of you that they are safe and they are effective. They are a useful tool that you can include in your fight against atopic dermatitis. But you should only use them when they are prescribed to you, and you should only use them under your doctor's supervision. So, a final note. I'd like to encourage everyone not to lose hope, not to give up, and don't bail out, because there is effective treatment available for atopic dermatitis. And early effective treatment can prevent chronic disease. It can help your child outgrow the disease. Early and effective treatment can improve your quality of life, and it can allow you to resume your favorite activities quickly. And finally, early and effective treatment can prevent all the psychosocial repercussions of the disease. Thank you so much for your attention.
Thank you, Dr. Jean. That was really informative. Thank you so much for sharing so much with us here today. I want to go to the chat right now because I just saw this. A lot of people saying good morning. So I want to say good morning to Cheery. Hello. Thank you for texting in the chat. Hello to Siuhan as well and Jackie. Actually, Dr. Jean, so Jackie had a question. I want to go up to that. Very interesting question. Is dermatitis actually contagious?
Okay, thank you, Jackie. Yeah, for a wonderful question. Yes. Now, dermatitis is not contagious. So you can rest your mind on that, and you can also reassure your friends, who have atopic dermatitis. And this is because it is not caused by an infective agent. It is in fact a hypersensitivity reaction that your skin is having towards certain elements in the environment.
So if someone has a family member at home who has a baby, even a kid, and then you're constantly helping them with the condition, there's no worry, right, that you will contract it just from helping them out?
No, absolutely not.
Okay, thank you for that question, Jackie. I'm sure a lot of people concerned about that as well. We do have one coming in from Siuhan. Good morning, Siuhan. I think you did mention this in the presentation earlier about frequent hand washing or the types of soaps, right? But then what is the tip in terms of washing your hands properly and not worsening that skin condition?
Yes. Thank you, Siuhan, for another great question. And this is so relevant right now in the pandemic. So yes, hand washing is an important practice. Okay, important practice of personal hygiene. Yeah. However, we fail to realize that with the number of times that we're washing our hands, the skin is undergoing constant insults from the water, from the type of soaps that we use. So the choice of a cleanser or soap that we're using to wash our hands is so crucial. If you could be using a harsh soap, like an antiseptic soap or an antibacterial soap, and if you're washing your hands 10, 20, 30 times a day, now can you imagine, what sort of damage that could be doing to your hands?
Yeah.
So the most simple step, the most basic change, okay, lifestyle change that you can adopt, and if you do have to wash your hands frequently for whatever reason, is really to start to go back and use a very mild and gentle and non-irritating soap.
Okay, so that's what they should be looking out for when shopping for products.
Yes.
All right.
Mm.
Great tip. Thank you. I see a question from Sheena. Very interesting. What is the effect of gluten intake on AD? Is there any sort of connection at all?
Well, Chia, this is food, the connection of food with skin. This is a huge debate. And there are so many controversies surrounding this topic, so many controversies, and there could be so many myths and so many speculation. So I can't comment too much about it. And that is, I think, if you do suspect that gluten could somehow be connected with your skin, I would encourage you to actually speak to your dermatologist, go and see an allergist, and discuss with the doctor. You might need some further testing to confirm or to exclude that.
Right. Okay. Yeah. Earlier on, you were mentioning something about that gentle cleansers, gentle products, because we have no choice. We do need to wash our hands, right? Serena actually sent in a very interesting question right before the event. She asks if she's purchasing skincare products, are there particular ingredients that she should look out for?
Okay. So thank you for another great question. Right. Yes. I mean, now in the age of e-commerce, it's we have the whole marketplace open up to us at our disposal, right? And so many products to choose from, which ones are safe to use, which are good for my skin, which is not going to irritate my skin. So I think first and foremost, it is good to understand what skin type do you have. Okay, is your skin type, do you have a normal skin type? Have you had any issues? Have you had any past experience with eczema or skin sensitivity, or maybe perhaps you even have a history of atopic dermatitis? Now, if you do fall within that category, then yes, I would say, be extra cautious, before trying out new products or experimenting with new products. First and foremost, try to keep your routine as simple as possible. The second thing is when you're looking for some cleansers, which is a very basic skincare item, look for products which are low in sodium lauryl sulfate, and look for things which contain sort of like more gentle cleaning agents. We call them Syndets. So Syndets are basically sort of synthetic alternatives to the traditional soap, right? That does a great job at cleaning the skin, but yet at the same time, doesn't strip your skin of these sort of like precious moisture and protective barrier. And of course, when you go into sort of like using moisturizers, serums, on a daily basis, I think for a start, try to go with things that are preferably non-fragranced or very, very low in perfumes. And subsequently, introduce products slowly, just one at a time, right? I think, that's a very reasonable, that would be a very reasonable and easy way to approach.
Yeah, that sounds reasonable. Easy to start off that routine as well. Thank you for that, Dr. Jean. Looking at the chat again, if you have any questions, please feel free to send it on in the chat. We have one from Naomi. Morning, Naomi. Thank you for your question. So, Naomi, I'm so sorry that this seems like a very difficult situation. Naomi says that her family member has eczema. Her brother also gets eczema very badly. He tends to scratch a lot until his forearms bleed, very similar to that example that you gave earlier on. And she herself, Naomi, has eczema as well when she eats peanuts. Now, I know that you have mentioned multiple times that the food connection, it might be a separate thing, it might be conjoined, who knows? But she also gets lockjaw as well. So I think it sounds like a bunch of things going on. How would her, Naomi, and her brother manage all these, conditions of itching and lockjaw and all these things?
Okay. All right. Yeah. Thank you, Naomi, for another great question. And yeah, I think firstly, I would like to say, Naomi, that I fully empathize, and I think I can appreciate, the struggles that you and your brother go through on a daily basis, trying to sort of, wrap your head around all these things, right? Yes, and for many patients with atopic dermatitis, and especially of the more chronic and severe kind, it can be so confusing at times. And I think first and foremost, Naomi, I still have to sort of go back down to the basics, and the basics is treat your eczema. Get your eczema treated. This is not something that you should take upon yourself to solve the problem. Okay, seek help. Consult. Go to dermatologist. Okay, have a proper assessment. Okay, of your skin. Have a proper assessment of the severity of your condition, and then work together with your doctor, with your dermatologist, to find out, what is the most important things that need to be done, okay? And after that, what else then can be looked at so that, you can have as a holistic approach as possible. But Naomi, yes, it is, for situations like this, I would say, sit down, have a good discussion with dermatologists, okay, work out a treatment plan. And believe me, it's you will be able to find some sense. You can make some sense out of it.
Yeah, it's really interesting because I think maybe with skin, there's this misconception that it's just a beauty product or it's just whatever, right? But I used to have a patch of eczema as well. And the actual patch wasn't that serious. It was the after effects of scratching and not taking care of it, not seeking help that made it so much worse. And then when they actually treated it, it went away so quickly and I could have gotten help so much easier. You know what I mean? So yeah, I can avoid yourself a lot of problems. So thank you, Dr. Jean, for that. I'm looking at a question from Priscilla. Actually, this is very interesting because this becomes like a logistics thing, right? You have your moisturizers that perhaps you're buying from another brand or whatever, and then the doctor prescribes you a steroid cream. Are you able to use that together, or do you only need to use medical products, once you have that steroid cream?
Yes. Well, thank you, Priscilla. That's a very, very practical question. Very practical question. Okay. So what is this is and this is a very widely accepted practice that I'm going to share with you now, and that is you should use the steroid cream together with your moisturizers. Okay, because they go hand in hand. It doesn't matter if you use it before the moisturizer or if you apply it after the moisturizer, okay? It's fine, yeah. But they should always go hand in hand. And the reason is because they actually do different things. So the steroid cream is a very effective anti-inflammatory and anti-itch medication, and that helps to soothe and down the redness and the swelling pretty fast. But at the same time, we need to also heal and restore the skin barrier, and that is where the moisturizer comes in. And I do encourage everyone to moisturize as often as you can, because that has actually been shown to actually reduce the need to have to use the steroid cream in the long term.
That's a very, very good tip. I have a personal question that I personally want to know about this, right? I've heard about over moisturizing. Is that a thing? And how do we manage that?
Okay. Oh, yes, that's the
For
that's a
dry
tricky
skin
question
especially,
too,
right?
Kim.
Yeah.
Okay. Well, okay. To simply put, it is very unlikely to over moisturize. Okay, it's very unlikely to over moisturize for patients with atopic dermatitis.
Right.
And the reason is because their skin is already so inherently damaged and broken. It is as if there is no skin. You know, it is as if the skin is really not doing what it's supposed to do. Okay, so the moisturizer helps to kind of like double up, you know, as a replacement while, you know, the child is recovering from the disease. However, over moisturizing can only rarely be an issue. Okay, if there is a conflict in terms of the type of moisturizer and the location of application. So, for example, if a patient is using an extremely thick and oily moisturizer on perhaps a part of the body that is hair-bearing, then the moisturizer may occlude the pores, and that sometimes can lead to sort of other unrelated problems like acne or some hair infection called folliculitis.
Right.
And another scenario would be over moisturizing, for possible over moisturizing, okay, is if the moisturizer is applied constantly, okay, but yet there is very little regard to adequate cleansing.
Right.
So what this can possibly lead to is that, because we know that in patients with eczema, the skin immunity is already weakened. Okay, and so if there is this sort of like, you know, lack of suitable cleansing, but just, you know, constant application of moisturizer, then yes, sometimes that can also create some issues like maybe a little bit of a bacterial infection, you know, that can occur. But I think by and large, Kim, you know, we simply cannot over moisturize. No, we cannot, there is no way you can over moisturize for kids with atopic dermatitis.
Right. Yeah. No, and if I want to bring up a very important point that you said, yes, moisturize, but also cleanse in between, because if not, it's just layers of like, you know, just oil and moisturizer forever. You did mention the hair-bearing parts of the body, right? So I want to move back the question from Trizol. So this is a very interesting question. Trizol asks, does AD on scalp cause hair loss? Because Trizol was prescribed steroid spray for their scalp, but it's been about a year and it still itches. So any recommendations on that?
Okay. All right. Thank you, Trizol. Yes, AD can definitely affect the scalp. And in fact, AD can affect any area as long as that's skin, right? So AD of the scalp is a very common problem. Yes, and sometimes the child can, or the patient could scratch so hard until the hair falls out. But the good news is that the hair loss is not permanent because the hair follicles are still very much intact. And with a good treatment, okay, to sort of like get the inflammation down, the hair should grow back.
Right. Okay. There you go. There's some hope, you know, even if you're struggling with it, it can still grow back. It's not permanent. Speaking of this, right, this concept of, you've spoken a lot about kids getting it. And then, you had that graph earlier on, the study that shows that thankfully 2/3 of kids grow out of this. And then even for the ones that don't, you can still sort of help them out very, very much. What if a patient, someone is older, let's say 20s, 30s, 40s even, is it possible to develop AD? Or is there any kind of, dermatitis or dermatological conditions that can turn chronic that people should be concerned about?
Yes. Okay, thank you. That's another great question. Yes, so AD, although AD is really, very widely known as a childhood disease, but yes, it can start in adults. And the reason why that happens is that, the patient probably already has a genetic predisposition for atopic dermatitis, and that it just simply had not manifested itself when they were young. So if we look into the family history, there could be a family history of atopic dermatitis. And sometimes even if there wasn't, and if we sort of dig deep a little bit, we will find that, oh yes, they would react badly during seasonal change. Sometimes they would report maybe sort of like more severe insect bite reactions when they were young, or perhaps they would recall they will recall that I always had an issue with dry skin, all along. Yeah. So yes, in actual fact, though, you actually had atopic dermatitis all along. Now, for when we see adults with rashes, itchy rashes, they could actually belong. They apart from atopic dermatitis, we then also need to consider other possibilities. Okay, so what are some of the possibilities? So just give an example. I think contact dermatitis, that is something that we see a lot more in adults. For example, it could be due to irritation from frequent hand washing, and that will cause severe dermatitis on the hands. It could be contact dermatitis to hair dyes, for example, and that will cause very recurrent itching on the scalp. And of course, there is also a condition called neurodermatitis. And neurodermatitis is it's a condition which is very much related to stress. So if it's stress from work, stress from family, these can actually manifest as a neurodermatitis, and that can actually cause the condition to become very chronic and persistent. So, and I think there is also another scenario which I do encounter sometimes, and in fact, the patient does not actually have dermatitis, but the patient could in fact actually have a fungal infection, but was wrongly diagnosed and treated as for dermatitis, and that's why it didn't get better. But when with the correct treatment, that you resolve the problem really quickly.
Right. Yeah. So I mean, it's not just one skin condition, right? And I guess what we take from that is that yes, even if you do develop it as an adult, there is still a possibility, in fact, a strong possibility that you can get treatment and get better. Yeah. Yeah, it's good to know. Very, very good to know. Anna has a very interesting question. Is AD, in terms of treatment, is AD very similar to psoriasis?
Oh, okay. Very, very good question. AD and psoriasis are the two commonest chronic inflammatory conditions that we see in our daily practice. But they are very, very unique conditions. They are very different, and because they have very different pathology and physiological process. So the short answer is no, they are not the same, and they are very, very unique and separate entities with very different approaches to treatment.
I think the main gist, the theme that I'm getting from all these responses is that you need a doctor, just like how we can't diagnose ourselves, with all these whatever sicknesses we have. You need a doctor. Skin condition is something that you need a doctor for as well. So thank you, Dr. Jean. Now I want to close off this Q&A session with something that I think is very relevant right now. It's become like a hashtag and all that, right? Have you seen the hashtag Mask Me? Mm-hmm. Yeah. And is that something that you're seeing? I mean, not I know you specialize in pimples like acne and stuff like that as well, but in terms of just that whole area being covered all the time for long hours for many people, right? How do you manage that dryness, oiliness, all these kinds of things? How do you deal with that these days?
Yes, yeah. A great question, Kim. Great question. So just to share with you, I had a patient who came to see me, a few months into the pandemic, and she had a breakout of mask acne, okay, and also mask dermatitis, yeah. So the question to me was, so I asked her, I said that, are you still moisturizing? Are you still putting your creams? Are you still keeping to your routine? She said that, oh, well, actually I haven't been moisturizing anymore. And then I asked her, I said, oh, well, really? Well, why? Why not? So, well, because I've got the mask, and the mask on every day, and the mask is protecting my skin, right? And I've got all these sort of moisture and vapor, that is trapped within the mask. And, I figured out that this is good enough to sort of hydrate my skin.
Oh, no.
So yeah, that's right. So it's these things are so intuitive, and so I had to explain to her. I say, "Oh no, I'm like, dear, I'm so sorry to inform you, but in fact, all that vapor and all that humidity that is trapped within the mask, it's actually not moisturizing your skin. It's making your skin damp." And when your skin is damp, it actually weakens your skin barrier and actually makes your skin drier. So please, you need to moisturize even more so because of mask wearing. So I think a few tips I want to share with you, with your audience, in response to your question, Kim, right? So number one, please continue with your moisturizer. The mask is by no means a protection. In fact, the mask would consider be another insult to the skin. So using a moisturizer, will help to reverse that dryness that is created by all that humidity. Now, the other thing that happens with mask wearing is that there's also increase in temperature. As increase in temperature, ambient temperature in the air that's immediately just next to the skin. We call it the microenvironment. And this, when you couple it with sweat and you couple it with a bit of sebum, that becomes very conducive for a bit of bacteria to grow. So regular cleansing is important. Okay? And for some patients who are beginning to experience a little bit of mask acne, you can go to see your doctor, your dermatologist, and get a prescription for like an antibiotic gel to apply. And that is very useful to help to sort of soothe and calm the skin down. And finally, okay, for most of us, who will have to wear masks, on a daily basis, I would say use less makeup because you really don't want too much stuff on your skin. Yes, but less makeup, yes. But nevertheless, but not bare face, please. By no means bare face. Yes, use I would encourage you to use a tinted sunscreen. Okay, use a sunscreen, tinted sunscreen. Okay, you still need some protection. Okay, for the rest of your face, against UV pigmentation, skin tanning. And if you can't, use a lightweight sunscreen, which still allows the skin to breathe, and it will not be, clogging or comedogenic.
Yeah, great tips. Thank you, Dr. G. That was really, really useful. There's a lot of questions answered here today. So, hey, by the way, if you want to check out products in terms of like sunscreen and all that you just mentioned, Mask Me specifically, which I think so many people are struggling with right now, Uriage actually has a bunch of products that deal specifically with that Mask Me. So you can check out their social media pages, Instagram, Facebook, and all that. In fact, I think we're going to flash the Uriage social media pages in just 1 second, right? And as well as Dr. Jean's contact details, going to flash that in a bit as well. But first, I know people are very excited about getting that goodie bag. which is, understandable because there's so many good things inside. So different Uriage products, but all very, very good specifically for dry skin. There's stuff in there that helps to soothe itching, especially, which can be very helpful if you're in the middle of your treatment. If your skin is already cracked from past or long-term dryness, some Uriage products in there also helps to repair the old and new cracks as well. And Dr. Jean just mentioned sunscreen. That is not a beauty product. That is to, protect your skin from the sun and sun damage, and as well as, reduces dryness at the same time. Uriage has that in the goodie bag for you as well. So I want to show you how you can collect that goodie bag. Okay, we'll send it to you. You don't need to come down anywhere. But these are the details. I'm going to have it on your screen in just a second. So basically, if you're looking at your Zoom screen right now, right, just kind of move your mouse around, then you see a chat button at the bottom. So once you click on that, you'll see that the chat is going to everyone, right? Change that to Uriage Singapore and then send us your email address. So that means that the Uriage team will get it and they will send an email confirmation to that, get your address and all that, and then we will deliver the goodie bag to you. So no need to pick it up anywhere. So just so you know, the mailing address that you provided when you signed up for the event, that is what the goodie bag will be sent to. That's where the goodie bag will be sent to. So just take note of that. So once again, you can do that in the chat in the next few minutes before we leave this session. And we also want to let you know, we're talking about Uriage products. Dr. Jean has been recommending gentle cleansers. I heard that so many times. It feels like one of the biggest takeaways of this session. So I want to tell you about this website, grabtoglow.com. Right now, there's a huge promo happening right there. If you use the promo code Uriage Live, you can see it on the screen. You can take a photo right now on your phone so you don't forget. Uriage Live, use that promo code before the 30th of September, end of next month, and you get 30% off Uriage products. So it's a very, very good deal if you need to switch up your facial routine, your cleansing routine. It's perfect time. And now as well, you get a free 50 milliliter bottle of Uriage thermal water with any Uriage order. So again, perfect time for that. If you need help from Dr. Jean, or if you need to check out more Uriage products, here's some details for you to check out. Again, please feel free to take photos of that on your phone so that you don't forget. I'm going to leave this chat open just for a little bit longer so that you can send in your email addresses. If you missed it earlier on, if you send in your email address, that's when you get the goodie bag sent to you full of Uriage products. So please don't forget to do that. If you want to check me out on Instagram at Power98 Kim, I have no skin tips for you. In fact, I think I need Dr. Jean's help. So don't follow me if you want skin tips. I'm not the person. Dr. Jean is the one, and Uriage as well. Thank you, Gary. Thank you, Candy. Thank you, everyone, for texting in the group chat and being so nice early on a Saturday morning. Yeah, I know. It's everyone's talking about itchiness and all that, right? We're gonna do our best to help you out with these Uriage products, and as well as Dr. Jean over at her clinic. So thank you very much. You will see on screen right now, that is what you need to do in order to get the goodie bag. And let's check with the team. Are we gonna leave this chat open for a little bit? For 5 minutes. All right, 5 minutes. Now, maybe for this 5 minutes, I see people still having a bunch of questions. Dr. Jean, would you speak to us for just 5 minutes to answer these questions?
Yeah, certainly.
All right. So I'm scrolling up. If you do have questions, we have a bit more time. Please feel free to send them into the chat. Suan actually asked, she has dermatophthalmoma. Am I saying that right? Dermatophthalmoma? Yes.
Yes.
So Suan asks, what can she do about that?
Okay, so Suan, can I confirm that it is dermatofibroma?
Yes, that is probably what it is.
Okay.
Yes, thank you, Dr. That's why Dr. Jean is the expert here.
Okay. Okay, but that's a side note. It's got nothing to do with atopic dermatitis.
Okay. So that's a completely separate thing, is it?
Yes, that's right. Separate.
Okay.
Yes.
So
yes.
I would imagine that similarly, go to a dermatologist, get help. Same thing, right?
Yes, that's right. Yeah, but I think just very quickly, a dermatofibroma, it's a very common and benign lesion growth in the skin, and it is a because it's quite harmless. So, you know, you can, you have an option to leave it alone and just monitor, or you can opt to get it removed by a surgery, and we call it, and the surgery is called a skin excision.
Right. Okay. So that's the main thing that you would suggest for someone with that.
Yes.
Oh, actually, Pepe has a very, very interesting question. She asks, she notes that sunscreen is important, but if she has eczema on her face or neck area, right, does it irritate the skin if she uses sunscreen and then makeup remover later on at the end of the day?
Yes. Yeah, that's a great question. So, really, to answer that question, it really depends on the current condition of your skin. So if you have atopic dermatitis, my question would be, is your atopic dermatitis, is it active right now? Is it flaring? Or has it been treated? Is it under control? Is your skin calm? Because this makes a huge difference, whether you can tolerate anything at all. Okay. So, you know, if you're having a flare of your atopic dermatitis, yeah, then, you know, you may not be able to tolerate, you know, any sunscreen, you know, and sometimes even creams, moisturizers, some moisturizers can even sting. It can, you know, it can cause stinging sensation if your skin is broken and if it's raw.
Right.
So, so get that treated first. Get it treated, right? So, sunscreen, of course, will have to take a back seat.
Right.
But once your eczema is healed, okay, and the skin barrier is restored, then you should have no problem tolerating some of the sunscreens which are available. Uriage, they've got a good range, which are designed for sensitive skin. They are fragrance-free and very low in preservatives and low in chemicals. So these will it's a good place to start, you know, if you're looking for sunscreen for your skin.
All right. Thank you, Dr. Jean. Thank you, everyone, so much for your questions. And thanks for sending your emails in as well. So we hope you enjoyed that Uriage goodie bag. And we also hope you enjoy the rest of your weekend. Thanks, Dr. Jean, for being here with us.
Yes, you're welcome. Yes,
right.
I'm happy to be here. Thanks, Kim.
Thank you, everyone. See you soon. Bye.
Thank you. Bye.